Hey everyone, and welcome to the Balanced Bodies Blueprint. I am your host, Vinny Russo.
And I'm your co-host, Dr. Eryn Stansfield.
And we're shifting gears from all the conventional fitness narrative you hear on most fitness podcasts, as our main emphasis lies in preventative healthcare, adopting a holistic approach to nutrition, and challenging the traditional views on various fitness topics.
Our mission with this podcast is to provide you with the information you need to achieve optimal health.
And on today's podcast, Dr. Eryn is going to be doing a solo episode. She's going to be diving into vitamin D. I'm a little under the weather, as you could probably hear in my voice. And so she decided to take the liberty and do a solo episode giving some new information about vitamin D. So without further ado, here is Dr. Eryn.
Hello, everyone. So this episode is just me talking about the new Endocrine Society guidelines on vitamin D. I thought they were interesting because we see a lot of testing for vitamin D by primary care physicians, by a lot of providers out there and nurses out there. And when I did my medical school training, I wasn't really taught about vitamin D supplementation. And even through residency, it wasn't till later that this trend came out. And I'm in a specialty where we look at a lot of the guidelines. And I was taught that vitamin D should be supplemented in people that were older. So we're talking about maybe 65 and older, and if they were at risk for osteoporosis, for example. So that's when I thought you actually give somebody vitamin D and you kind of do the testing for vitamin D. And there was this new trend the last few years where everyone was just going to their doctor and it was part of their routine physical to get tested for vitamin D. And so that's why I want to talk about these new guidelines that the Endocrine Society came out with. They are on their website if you want to check them out. They will be published in a journal this month in August. And I believe the journal is put out by the Endocrine Society, or it's called the Clinical Practice Guideline by the Endocrine Society. Anyway, let's get into it. So basically, what they came out with was that if you are a healthy adult under the age of 75, that you are unlikely to benefit from taking more than the daily intake of vitamin D recommended by the Institute of Medicine. And I'll get into what the daily requirement is. And most importantly, it is not required to be tested for vitamin D if you are a healthy adult. I'm talking about an adult without other chronic medical issues, and we'll get into the ones that I'm talking about. But if you're a healthy adult, you don't necessarily have to routinely get blood tested for vitamin D, and you don't necessarily have to supplement if you're getting it from your diet or you're getting the daily allotted or recommended amount. So let's get into that. Like I said, there was a huge trend for years and years to get routinely tested for this. A lot of practitioners out there were doing it, including myself, and it's not necessarily recommended. Now, the people that are recommended testing and or supplementation are typically going to be children, pregnant people, adults that are older than 75 years old. And then I thought was interesting is people that are at high risk for prediabetes. So, if somebody is suspected to have or be in a pre-diabetic condition, then they actually might be recommended. There's some, and we'll get into this a little bit later, there's some data to indicate that it might help with their risk profile. So it might be good for them. So let's talk about vitamin D and blood testing. So a lot of vitamin D use and blood vitamin D levels had been associated with many common diseases. And that's why there were for many years this routine testing. And it was thought that vitamin D supplementation lowered the risk of these diseases. And And that's why we tested for vitamin D blood levels to assess whether that supplementation needed to happen. However, more data came out that showed more mixed results in that area. And so that's why these guidelines were put out. In this new guideline, the panel of experts established guidelines for vitamin D use and testing for vitamin D in healthy persons without established indications for vitamin D treatment or testing. So the guideline relied on clinical trials to develop the recommendations. So they looked at all the clinical trials. And again, it will be published in the Journal of Clinical Endocrinology and Metabolism. And basically, when they were looking at this, one of the physicians said the goal of this guideline was to address the vitamin D requirements for disease prevention in generally healthy populations with no underlying conditions. So again, this guideline applies to people that are healthy, that don't have any chronic medical conditions. Again, it is recommended for people who are over 75, pregnant people, adults with prediabetes, children, and adolescents 18 and younger who do not meet the nutritional requirements in particular, but they don't otherwise recommend routine testing for vitamin D. There is a nuance to this, which wasn't directly ascertained like when I first glanced at these, but anybody who has other chronic medical conditions that might have malabsorption issues, so GI surgery or chronic GI issues, those people might need vitamin D supplementation and might actually be candidates to get vitamin D testing as well. So that is the caveat as well. It used to be thought that people that were, in their 50s that might be maybe starting to have quote unquote bone loss would supplement with vitamin D. This isn't necessarily the case. If you are concerned and you are in that age group, they do suggest daily low dose vitamin D instead of the non-daily higher dose vitamin D. And I think what they're referring to is sometimes there are vitamin D injections and you don't necessarily have to do that. And again, they suggest against routine testing for 25 hydroxy vitamin D in any of the population studies. So the healthy people, a lot of physicians would sometimes include screening in people that were with dark complexion or obesity, and that's not necessarily the case anymore. Let's talk about why they came up with this. So basically, again, I had alluded to the fact that it was thought that vitamin D supplementation would help prevent some chronic diseases and maybe decrease the mortality rates of some of these chronic issues. And that hasn't come out from the data. It has come out for the older population first. So people that are over 75 should supplement with vitamin D and should have their levels measured. Those people actually do have benefits with mortality. But for disease prevention in the healthy population, the same associations have not been shown. So when they looked at like the pre-diabetics, for example, they looked at 11 trials that tested a daily dose of 3,500 IUs of vitamin D, and they showed a slightly lower risk for progression to diabetes. And a review of the prospective studies concluded that vitamin D levels outcomes in high mortality conditions are unlikely to be causal. So basically, that's a fancy way of saying what I just said, that really disease prevention doesn't happen in these healthy populations with vitamin D supplementation, and thus checking vitamin D levels is really unnecessary. One nuance, I think, is that the American Academy of Pediatrics recommends supplementing vitamin D in breastfed infants. But the Endocrine Society takes out a bit further, saying that supplementation should continue through childhood. So that's a little bit of a difference there. So let's talk about the recommended daily amount of vitamin D that is recommended. So children up to 12 months, 400 IUs is recommended of vitamin D. People ages 1 through 70, 600 IUs, and then people over 70, 800 IUs. And then you can look at sun exposure. But again, I think that it's more of an age thing. Older adults, 65 and older, you can actually supplement up to 1,000 IUs. Pregnant and breastfeeding, up to 600 IUs should be used. Most multivitamins, so if you just took a multivitamin and you're a healthy person, you're supplementing 400 IUs of vitamin D right there. A lot of people just get it from their diet, milk, yogurt, orange juice. Cereals are fortified with vitamin D. They can provide servings up to 100, or typically provide about 100 IUs of vitamin D. Obviously, that's going to vary, but other sources might be fatty fish, salmon, for example, fish liver oils such as cod oil, liver oil, egg yolks, beef liver, cheese, and mushrooms, bananas. So there's a whole bunch of food sources. So basically, the point of this is that if you are a healthy individual with no chronic problems, you do not have to routinely get tested for vitamin D. Especially if you are meeting the daily requirement, and you can do that with a multivitamin if you choose, or you can do it with food sources. So that is up to you. Now, if you are over 75 or a child, or even an adolescent, or younger, then you may need to supplement, and then in pregnancy as well, and then pre-diabetics. Those are the recommendations. I hope that was helpful. I just want everyone to know that, if they're really concerned about their vitamin D levels, that if you're healthy, that concern is, you can put that one away for now, and just make sure you're getting vitamin D from your diet or a multivitamin.
So on behalf of Balanced Bodies, we just want to say thank you for joining us on this episode of the Balanced Bodies Blueprint.
We are committed to bringing valuable content. And if you enjoyed today's episode, we'd greatly appreciate it if you can take a moment and like it and leave a 5-star review.
On Apple, just go to the show, scroll down to the bottom and rate it there. If you're on Spotify, go to the show's page, click the 3 dots, and you can rate it there as well.
And if you believe in the power of knowledge, share this episode on your social media to try and get the information out there to as many people as possible.
And as you navigate your own path towards better health, remember that Balanced Bodies is forever in your corner. See you all next week.
The podcast content may include discussions of medical topics and health-related information. However, the information provided should not be considered exhaustive or complete, and it should not be relied upon as a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition or treatment.